Medicare is not the same. That's right. Medicare is different from traditional insurance models. And in this video, I'm going to talk about the differences between traditional insurance and Medicare. And stay until the end because I'm going to talk about the three biggest mistakes that I see that people going on Medicare make. So, under traditional insurance models, such as employer insurance, insurance directly through the insurance company, insurance through the federal government, insurance through the state, whatever it is, usually you get one card that covers everybody in your family. Your deductibles are one deductible. It's usually either a single or a family deductible. And all your benefits are under one card. Sometimes you might have a separate card for dental and vision, but most time all your benefits are loaded under one card. You also have a yearly benefit known as your benefit period. Sometimes that benefit period goes from January 1st through December 31st. Sometimes it may go from October 1st through the next year and start over on the next October 1st. Medicare is definitely not the same. Your benefits and coverage under Medicare is divided into parts. Those premiums for those different parts are divided too. Your benefit period under Part A does not work the same way as your benefits on your job. So the parts of Medicare are Part A, Part B, Part C, and Part D. And each part covers something that you would normally get under your all-in-one benefits under traditional Medicare. The other thing that you need to know is that under original Medicare, there is not 100% coverage for services. When you were under your employer-based coverage or whatever coverage you had, at some point, depending upon how sick you got, you would reach where your plan would start kicking in at 100% for all services. If you just have original Medicare Part A and Part B alone, you will never reach 100% coverage. And another thing you need to know is that there are services that you got covered under your traditional healthcare model that Medicare does not cover. And so we're going to talk about some of that in this video. All right, so let's look at some of the benefits that Medicare Part A covers. When you think of Part A, think of inpatient services. So you have inpatient services such as being inpatient in a hospital, being inpatient in a skilled nursing facility, being inpatient in a hospice situation, and then also home health services are covered under Part A. Now let's look at Part B services. When you think of Part B, think of anything outpatient and professional services. So Part B covers a lot of preventive services, such as mammography exams, your yearly wellness exams, but it does not cover physicals. Your Part B would also cover x-rays, lab work, MRIs. It will cover outpatient surgeries. It will cover doctor's fees, doctor visits, specialist visits, and also drugs that would require the doctor to administer, known as transfusion drugs. So that wraps up Part B. Then we have what is called Medicare Advantage or Part C. All Part C is Part A and Part B combined through a private insurance carrier and offered more comprehensive benefits than Medicare Part A and Part B alone. So your Medicare Part A, Part B, and sometimes Part D is lumped into one plan that is through a private insurance carrier. But you still have to pay your premiums for Medicare Part A if you have them, Part B, And then your Part D can be included into your Medicare Advantage plan, also known as Part C. All right, and then let's look at Part D. Part D is for prescriptions at the pharmacy. That's what it's designed for, is that it's designed to give you coverage for prescriptions that you would either pick up at the retail pharmacy or that you would have mailed to you. So that's what Part D covers. So that one all-in-one plan that you had through your job, where you had one card with all the benefits, are divided into parts with Medicare. And there are different cost structures where you paid one premium on your job for everything, you'd have separate premiums for those different parts of Medicare. So let's look at your Part A costs. Usually, if you have worked at least 40 quarters or 10 years in the United States and you paid into Social Security, Part A is generally premium free. In other words, you get it free. But if you have not paid into Social Security the allotted quarters or 10 years, then you could have to pay between $278 per month up to $506 per month for your Part A. If your spouse worked at least 40 quarters or 10 years and you didn't, you still could qualify for premium-free Part A. Now, let's look at the cost for Part B. The base rate for Part B is $174.70. This is the base rate for most people that go on Medicare. However, you may have to pay more for Part B if you're single and you made $103,000 of taxable income in a year. Or if you're married, the threshold is $206,000 in a year. That would require you to pay more for your Part B coverage. If you have to pay for Part B, you will have to pay between $244.60 per month per person and as high as $594 a month per person for Part B. Now, if you choose to enroll into Part C, which is known as Medicare Advantage, one of the things that you need to know is that if you have to pay for Part A, you still got to pay for Part A. And if you are paying for Part B, you still have to pay for Part B in order to stay in the Medicare program. Your Medicare Advantage premium is a separate premium that is paid to the private insurance carrier that manages your Medicare. Basically, what happens if you sign up for Medicare Advantage, the private insurance carrier that you choose will become Medicare for you. So what that means is that when your doctor files a claim, they no longer file the claim with Medicare. They will file that claim with your private insurance carrier of whom you choose. Keep in mind, you're still paying any original Medicare Part A and Part B premiums. When it comes to Part D, you still have to pay any Medicare Part A and or Part B premiums. And then your Part D is a separate charge. So you have a charge for Part A if you didn't work enough or pay into the Medicare system. You have a charge for Part B. And if you have Part C and your Part D coverage is included in your Part C, you may have a separate charge for Part C. Or if you get a standalone Part D plan, you will have to pay a standalone premium for your Part D coverage. Now, that's not all. One of the things that you need to be aware of that is different from traditional insurance models is that you will be charged a late enrollment penalty if you do not sign up for Medicare when you are eligible, unless you have credible coverage and can prove it. So if you sign up for Medicare late, you will have to pay more for your Part A depending upon how long you went without it and whether you were eligible for premium-free Part A. You will have to pay more for Part B, and the penalty under Part B does not go away. It stays with you for the rest of your life. And how that penalty is calculated is for every 12-month period that you were without Part B coverage, you will be assessed a 10% penalty of the Part B premiums. For Part D, the penalty is a little bit different. For every month that you could have been in a Part D plan but was not, you are assessed a 1% compounding penalty of the national average of Part D plans in the United States, and that penalty is rounded to the nearest 10%. That means if you go 5 years without Part D coverage and you finally get into a Part D plan, and you had no credible coverage to show, hey, you can't charge me the penalty because I had credible coverage through my job because I continued to work, you will face a 60% penalty of the national average. It's almost like one of those things where if you don't buy now, you're going to pay more over a period of time. And that's the difference between traditional health insurance and going on Medicare that you need to be aware of. So as promised, I told you at the end of this video, I'm going to give you the 3 biggest mistakes that I see people going on Medicare make. One of the first mistakes is that they only sign up for original Medicare. Alert, alert, alert. Original Medicare never pays 100% of anything. So if you come down with a major illness, such as cancer, be prepared to pay thousands and thousands of dollars out of pocket because Part A and Part B alone never pays 100% of anything. The second mistake that I see is not signing up for Part D. I have ran into a lot of individuals who said, it doesn't make sense for me to sign up for Part D because I'm 65, I'm not taking any medications. Every month that you could have had a Part D plan and chose not to enroll, you are assessed a penalty. It is better for you to take the cheapest Part D plan on the market available in your area than for you to go without Part D coverage. Because when you have to pay that penalty does not go away. So that means you pay more over a period of time than what you would have paid had you signed up and got the cheapest Part D plan to say, hey, Medicare, you cannot charge me a penalty because I at least had a plan that was credible, and that was it. The third and final thing that's one of the biggest mistakes for a lot of people going on Medicare is thinking that Medicare will start automatically. Medicare does not start automatically unless you chose to take Social Security benefits early. If you chose not to take Social Security benefits early, Medicare does not start automatically. You must call Medicare and get enrolled, and they will send you the paperwork in order for you to sign up for Medicare and start getting your Part A and Part B. And I'm going to throw in a fourth and final mistake that I see that happens all the time. Not choosing to work with a reputable agent that can give you the ins and outs of your Medicare coverage. I had a client that came to me, an agent called her out of the blue, said, hey, it's time for you to enroll in Medicare, enrolled her into Medicare, didn't ask her about her health conditions, didn't ask her about her medications, and she was on Humira. When she came in my office, she was outside of her enrollment period. There was nothing that I could do. I had to refer her to Medicare, to see if Medicare would grant her a special election period so that she could finally choose a plan that will give her coverage for the Humira and for her health conditions that she needed. Medicare is different. It is not the same. And there you have it. It is not the same. And if you want to know more about the 3 sneaky traps to Part A coverage, click on this video. Thank you for watching How to Medicare. I'm Lawrence Rush. It's been a pleasure. Don't forget to like and subscribe to my channel, and also click on that notifications button and comment down below.